I know we wanted to talk a little bit about the FDA just came out with sort of a new warning with radiofrequency and microneedling.
Yeah, tell me about that, because I love to do microneedling treatments.
Yeah, and they are great. And I think the FDA, this is in the last month, came out with a warning, just warning to consumers, so people here in the US, about these devices. So radiofrequency is basically kind of like specially tuned electricity. It creates resistance in tissues, and that heats the tissue. And when we heat tissue to a good temperature, which is usually about 40 to 42 degrees Celsius, we can actually build collagen. That's a great thing. But if we're stacking energy too much, and if we're diving it down too deeply and don't intend to actually treat fat, there's sometimes we want to treat fat, we can have unintended sort of consequences. So the FDA warned that some of these devices, if they're not used according to the manufacturer's recommendations, if someone is not well trained and doesn't understand the mechanics, what we talk about is the mechanism of action of these actual procedures, they can cause scarring, they can cause pigmentary changes, they can cause disfigurement of tissues, and they can cause fat loss. And so most radiofrequency microneedling procedures that we're doing are really safe. We're using it in the dermis, that second layer of the skin. And so you want to make sure when you're talking to the person that's actually administering treatment, ask them, like, what's the depth? What was their training on this? If they just had a Zoom call with someone and they don't have real sort of life experience, ask them. You know, I would want to know how many years they've been doing it, what number of procedures have they had. Do they know how to handle complications? What are the common complications? If they won't sit down and actually go through a consent, and scarier, if you haven't signed a consent, that's something that you want to be wary of. So the FDA didn't shut these procedures down. The devices are great, but we just want to make sure that we're treating at the intended depth in the skin, and that the person that's driving the machine is well trained and well versed in the technology to be able to deliver safe and effective results.
Well